How would our next witness wish to be known?
She's called Theresa.
Thank you. Theresa, please. You can stand or sit, whichever you prefer.
Thank you.
Please state your full name
Theresa Ann Smith.
and repeat after me. I do solemnly, sincerely,
I do solemnly, sincerely,
and truly declare and affirm
and truly declare and affirm
that the evidence I shall give
that the evidence I shall give
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing but the truth.
and nothing but the truth. Thank you.
Theresa, you're here to tell us about your infection with hepatitis C.
Yes.
In December 1983, you required an emergency appendectomy,
Yes.
and you understand that you were given a plasma transfusion at that time.
Yes.
About a year later, you noticed you were becoming jaundiced whenever you got a cold or were poorly.
Mm-hmm.
And then at some point that jaundice became severe and you were admitted to hospital.
Yeah.
Can you tell us about that?
The doctors weren't sure what was causing it, because you shouldn't randomly become jaundiced. So they took me in to do some tests to find out what they thought was causing it. They did a liver biopsy, and a couple of days later came back to tell me, I believe it was them, that I got non-A, non-B hepatitis.
During that biopsy, a blood vessel was also nicked,
Yes,
and so you needed further blood.
I did.
And you don't actually remember very much of that time at all.
No, it's a blurry week that week. I was quite poorly. Yeah.
And when you were told that you had non-A, non-B hepatitis, what did you understand about the condition at that time?
Nothing. I just knew it wasn't A or it wasn't B, but they didn't really explain what the difference was, if there was a difference, what it meant.
Were you told anything about managing the condition?
Not at all.
Were you told anything about any precautions you should take?
Not at all, no.
And did they monitor you at all?
No. Not to my recollection, no.
In 1989, you gave birth to your son, Tom,
Yeah.
who's sitting with you today.
Mhm.
It was a difficult delivery, and your son was in distress.
Yeah.
When you asked about the chances of your son being infected with hepatitis, what were you told?
I didn't actually think of that until I started treatment myself over at Derryford, but I was told that it's quite rare for children of mothers with hepatitis C to be transmitted in the womb. However, it transpires that he was infected in the womb, they believe. So, yes, that's what they told me. It was infected with the same strain. So,
Your son was born with a rare illness called sacralogenesis. Can you tell us what that means for Tom?
well, it basically means that the bottom part, sacral area of his spine, did not form properly. So all these nerves, because they showed me a CT scan once, and it's all bundled up like a ball of wool. So all of the nerves that should be kept in a line by his vertebrae are just protected by a bit of cartilage. So there are lots of different effects. It affects mobility. I think your first operation at 9 months old to release the tendons at the back of his legs because he had no heels, and he was born with his feet inverted and inwards and up crossed over his chest, which is why I believe it was quite a difficult delivery, because they thought he was breech, but he wasn't. It was just he was in an odd position. It's meant he had quite a few operations through his life. They had to build him some feet effectively over at Bristol Children's Hospital when he was 7. He had 2 within a year. They broke all the bones in his feet because he was walking on the top of his feet. They thought he'd never walk, to be truthful. When he was first born, the doctor had to go and look it up in a book because he'd not seen it before. He didn't know what was happening. He came back, explained that it was this condition called sacrogenesis, and he explained to me that he would probably never walk, that you'd crawl all your life, that he could get renal failure, that he could have hydrocephalus.
Which is fluid on the brain.
Yes, it's common apparently in people with sacrogenesis. I don't know why, but that's so I'm told. As it turns out, the doctor was incorrect, and he just took it upon himself to stand up and walk one day. But I was given the impression it is a severe disability, but I was given the impression it would be extremely debilitating, and he would never be able to walk, and it might affect the length of his lifespan. So.
At that point, the doctors also said they wanted to do some tests.
Yes.
What were those tests for?
Well, they didn't know what caused it because it's a very rare condition. It usually only occurs if the mother has diabetes, and then only 1 in 200,000 children, I believe. So they couldn't work out why Tom was born with it, because I don't have diabetes and I never have had. So they did a few blood tests, and they also said they wanted to check me for HIV because I'd had blood transfusions, which was very unpleasant because at the time you used to wait quite a long time to hear back. So I was under the impression, as many women who give birth to children with any congenital problems, that you might have caused it. So I was wondering for 6 weeks if my baby was going to die, because I'd heard what happened to babies born to mothers with HIV. They died routinely. They were always on the news at that time. And I had to wait 6 weeks. And then I made a phone call to the clinic. She didn't want to tell me, because you're not allowed to tell people over the phone, but I couldn't go in. So she said, I'm just going to say it's not as bad as what you think it is. And I said, well, that's okay, because clearly that's not, you've got it. They did want me to go back and have it done again 6 months later, but I didn't, because I didn't think it was that in the first place, and I didn't want to put myself back through that, to be honest. And as they already know I got non-A, non-B, I don't know why it didn't occur to them either, but yeah, it was a bit stressful, to say the least. It was a traumatic time.
But at that stage, nobody said anything to you about non-A, non-B hepatitis?
Absolutely not, no. Never came up.
The tests were for HIV, they were negative, and that was the end of the investigations?
Yeah, they had no idea. I saw a geneticist when Tom was about 6 months old, and he couldn't explain it either. Nobody could.
Then in about 2002... you realised that non-A, non-B hepatitis was in fact hepatitis C. Yes. What was it that triggered that realisation?
I had a conversation with somebody who said that what I was describing with the repeated episodes of jaundice and the fact that I had what was termed non-A, non-B many years ago, he said, that's classic hepatitis C, did you know? And I didn't know, so I got in touch with the Lighthouse Trust, and they confirmed that was hepatitis C is non-A, non-B. I still didn't know at that point. And that's what sort of prompted me to go and have some tests to see if I actually had got that and what I could do about it.
And until that point, you had no interactions with anybody about your hepatitis C?
No, for 20-odd years. I expect it's about 20 years. Nobody had said a word about it.
You then sought out treatment, and you went to see and asked to be referred to Dr. Cramp.
Yes.
When you first saw him, you've said he was excellent.
He was really good. Yeah.
Can you tell us why he was particularly good?
Well, I do actually know that he's sort of like a leader in his field, but at the time he was he knew his subject. He explained to me what it meant. He explained to me there were treatments available. He offered me the chance to be involved in a trial that was running at the time, which was the ribavirin and interferon trial. So he put me on that. And he also offered to check Tom. When I mentioned Tom, he also offered to check Tom with a view to getting treatment for Tom. once he was of a legal age to do so, because he was too young at the time, so he had to wait till he was 18 to have it done. He also mentioned the Skipton Fund. I believe it was Dr. Cramp who brought that up, because I'd never heard of that before either. So he was the one that signed the forms and got it all sent in.
You said he explained everything to you in a very calm manner.
He was.
And set everything out for you for the first time.
Yeah,
You went ahead with the trial
I did, yeah.
for about 6 months, and you cleared the virus.
Yes.
But you've described the side effects as vile.
Yes, they were.
Can you tell us anything about that?
After the first few weeks, I was constantly nauseous. They had to give me medication because I just wanted to vomit all the time. At the time, my dad was in Derryford Hospital because he was in renal failure. So I was having to go there every day anyway. And I've never really suffered from depressive illnesses, but that treatment gave me such a depression. I just woke up one morning and it was like I was just crushed. I couldn't work out why. For a day or two it didn't sink in, but I just couldn't stop crying. I just felt like everybody I knew had died overnight. It was just awful. And apparently it was one of the side effects from the treatment. So I went along to the GPs and they treated it with antidepressants, but I also couldn't go in. I used to take regular exercise, couldn't do that because you couldn't breathe, because of your sort of blood cell count was affected by it. It wasn't very nice. It was very unpleasant. It was worth it, but...
When you first realised that you were depressed, you went to see a GP.
I did, yeah.
And they insisted you had to wait 2 weeks.
Yeah, because that would be the normal... that's their normal sort of course of action if you have a psychological depression. However, I knew it wasn't a psychological depression because I've never had it before, and it was just... I went to bed okay, and I woke up the next morning, I wasn't okay. So I left that with that GP, and then the next day I went back and saw a different GP in the same practice and explained to him that I know what this is. And he was kind enough to listen and provided me with antidepressants. I'm not sure how well they worked. I don't know, I can't remember truthfully because it's quite a little while ago. Maybe just the fact that somebody listened might have helped a little bit, but it had gone by the time I stopped taking the treatment. So.
Were you offered any counselling or psychological support during the time?
No.
You say in your statement that the effect of the hepatitis C on Tom has been tremendous, and you believe there's a link between the hepatitis C virus and his sacralogenesis.
I do.
Can you explain that for us?
Okay, so because I have none of the normal risk factors that might indicate your child could be born with it, if it does happen, even though it's so rare, I've wondered for so long what could have caused this, and I started looking into it, and it appears that hepatitis C is what's known as a flavivirus, the same as some other big viruses like Zika, for example, which affects bone formation in the womb. Tom's physical problems are caused by a lack of bone formation in his spine. I'm aware that they've done a little bit of testing, but not on humans yet, to find out if there's any link. But I do know that hepatitis C does do that in other mammals, such as cats. If you inject a pregnant cat with hepatitis C, its kittens will be born with deformed spines. So I feel, because I haven't got the risk factors in place, and because there seems to be evidence that suggests it could be that it's more than likely it's what caused it.
You said earlier in your evidence that Tom surprised everyone by getting up and walking.
He did.
But he's needed a number of operations to rebuild his feet and calipers as well. Yeah. He suffers constant pain in his feet.
All the time, all your life, haven't you? Yeah.
And hasn't been able to work.
as he's got older, it's got worse, you see. It's progressive because he's walking on plastic, effectively, and it's rubbing away the fat underneath his feet, which is what you need to protect your bones when you walk. Tom basically has got no fat left underneath his feet now, so the illness is progressing, and it's so painful now that he can't work.
He'd surprised everyone by going to university and then trying to find work,
Yeah.
but just couldn't sustain it because of the pain.
I think it was, the last time was about a year ago. He started a new job, and after his shift, which was 12 hours, 10, 12, Tom doesn't complain about the pain in his feet, but he rang me because he was in agony and he couldn't make it to the bus stop, which was not very far from where he was working. And he actually lacerated his feet just by being on them all day. He couldn't walk for days. And it's just not practical because he's putting himself through too much pain to go out and work. Although there's a downside to that, in that you need to go out and work, not just for the money, but he's a young man. You don't want to be stuck at home all day. So, and he's a clever man, I have to say. So it's just, it feels like it's a waste, and it's being caused by that condition.
As you said, Tom was also diagnosed as hepatitis C positive, and once he was 18, he also underwent treatment
Yeah.
with similar side effects.
I don't know. I think he sailed through it slightly, but that could have been an age thing, a little bit. I don't think it was quite so bad, but they cleared it. It started to clear quite quickly again, didn't it, as well? So yeah.
And he cleared the virus.
Yes, we cleared it quite early on, after a few weeks, but they kept us on the whole 6 month, obviously. So just see if it gone.
Since then, what's the effect been on you in terms of your physical health since you've cleared the virus?
It's difficult to quantify. I don't have ill health per se. I have a suspicion that it may be having an effect on my blood vessels because I get really cold hands. And when I say cold, they are so cold that I can't hold the steering wheel of the car because it hurts. I can't grasp things. It's not so bad this time of year, even though they're cold today, but in the winter, it went away for a little while I was on treatment and then came back again. So I'm not sure. I'm investigating whether there's a link in that. That concerns me slightly because you can't see the blood vessels inside your body. I can see the ones in my hands, but all the blood vessels in the smaller parts can be affected, so I need to find out, just in case it is that, because it's a risk to your life. It's life-threatening, so I need to find out. Apart from that, I can't honestly say that I think it affects my health.
But it has had a huge emotional impact on you, and particularly the fact of Tom's illness.
Yeah, it's difficult to believe that it would have happened had I not had hepatitis C in the first place. So, yeah, I think it's a guilt thing. Nobody has a baby expecting to give them something that's going to have a significant effect on their life. And I honestly believe that this did. I know it's not my fault I had it, but I still transmitted it, so, yeah.
You've said in your statement you have tremendous guilt over your son's illness following his birth and ongoing, as you thought you must be somehow to blame for it.
Yeah. When he was born, I thought it's got to be me. How can that happen? What did I do? And I felt that way for quite a long time at the beginning. And really, to a certain extent, it's true. I may have passed on something that's had a considerable effect on the ways life's developed. So, yeah, it does make you feel guilty. It does.
And you have ongoing fears of things in the future. You've described it as continuing to live knowing you're a living experiment in this illness.
I think we are. I think all of us who have been affected by it are, because they don't know, even if they clear it, And so we're living hepatitis C negative. This is a new thing. People used to get liver disease and they would pass. But with this, we're getting liver disease and we're being treated and cured. But nobody knows what's going to happen in the future. For all we know, there could be a 10-year period where all of a sudden that treatment stops working, or nobody knows. And all the time, there are new concerns coming out because people are living longer. There's a special category mechanism, is it called, that's just been introduced because the amount of people that have developed illnesses which are related to retrovirus as hepatitis C, it's a new thing. They didn't know about it. People would have died before. Many people probably have died before. But the treatment is keeping us alive, and the effects are sort of stacking up now.
You thought about bringing a legal case in relation to your infection and your son, but when you went to a solicitor, they assumed that you were an IV drug user.
Yes, they did. They did. I mean, the first time I came across hepatitis C myself was when I was working in care homes. I came across a few patients who had it, and they were described as drug users because of the hepatitis C. So I think that was a sort of stigma that went along with it at that time. Bringing it out into the open in the form of an inquiry and people coming forward has changed that. People are aware now. But it happened. When Tom went to have treatment at Derryford, he had a spider bite which had tracked because it was infected, and the nurse assumed that was from intravenous drug use. So there was a lot of ignorance out there around it.
And now, if you tell anyone that you have hepatitis C, you're very quick to say that you contracted it through infected blood.
I always say that. Yeah, I do always say that, just to be on the safe side. But I think people are much more knowledgeable about it now. But I do tell people. I always tell people because I work in the health profession. But yeah, I'm a little bit concerned that I was working with it for years and years and years without any knowledge of what was going on inside my own body and the risk of transmitting it to other people, because I will have worked with thousands of people over the years. And it does occur to me occasionally that it's difficult to know if you've infected anybody if somebody doesn't tell you to take precautions, because they didn't. So hopefully not, but...
You're now a qualified nurse, quite recently, but you still find it difficult at work that you were hepatitis C positive.
It's something I have to bring up in the course of every job, because it's my responsibility, and also because I would anyway, because I'd hate to think I did infect somebody by accident. I can't now. I'm hepatitis C negative, but all the same, as I say, I'm never sure that we're hearing the whole truth, because at the beginning we didn't hear the whole truth. We clearly didn't, because they weren't explaining what non-A, non-B was, for example, whereas in other countries they knew what that was. Yeah, I feel possibly things have been hidden from us for a long time, and they might be continuing to be hidden from us because it was a mercenary act to buy in infected blood, and nobody's taken any responsibility for it. And there's lots of stories out there where people have suffered.
And your fear is that that's continuing, which impacts your interactions with people at work and interactions with medical professions.
It does, yeah.
You and Tom received money from the Skipton Fund.
We did.
But then only very recently have you made a connection with EIBSS. How did you come to know about the EIBSS, and why was there the gap?
The gap could have partially been because I've moved, although I found out about the EIBSS payments through a documentary that was on the TV prior to the start of the inquiry hearings, and it mentioned payments, and it also mentioned within the course of that documentary that people with hepatitis C, they'd made efforts to contact them. they hadn't made efforts to contact them, unless I am an individual case that they didn't contact, because they would have contacted me, is the way I see it. So I found out about the IBSS payments through that programme.
So there were two issues that programme raised for you. One was why you hadn't been traced much earlier about
Yes.
having hepatitis C, having been previously diagnosed with non-A, non-B.
Definitely.
And you were concerned by that gap, that nobody had been in touch.
Particularly because it was made as an explicit statement that there had been great efforts made to track people down so that they could inform them what was happening and explain about any finance they may be due, or I wouldn't go so far as to say it's a deliberate lie, but it's a misstatement because they never bothered contacting me.
And secondly, in that programme, you realised that Skipton had become EIBSS, had been
Yes.
replaced by EIBSS, and you realised you weren't in contact with EIBSS and were missing out on financial assistance.
Yeah, I rang them that afternoon just to check, and they said, yes, you should have been paid from last year. So I did that, and I let Tom know as well. So we did.
But as far as you're aware, there was no effort to trace you from your Skipton application to when EIBSS came into play.
No, I don't think so.
You've said in your statement that your real concern is Tom, especially once you've gone, and the future effects on his own health.
It concerns me. If you have an illness, they can give you a prognosis of how it's going to develop and what's going to happen in the future. If it's a rare illness, it's harder, but they can often give you an idea. With Tom, I don't know that they can actually give me an idea because they don't know what caused it in the first place. Therefore, the prognosis that would normally accompany cyclogenesis that's been contracted through the mechanism of a diabetic mother, they don't apply. So I don't know. I don't know what will happen. I don't know how this will progress. That does concern me.
And it also concerns you in terms of financial provision for Tom.
Yes.
And just very practically what will happen.
Yes, yeah, it does. It does. I mean, because we've talked about the pain is so bad. You've talked about having amputations on your legs. And he will definitely get arthritis in his feet, both feet. He had a lot of surgery on his feet. So there's a lot of pain in the future. I'd like to think that there's something in place to make sure that if he needs anything, then it's properly looked after. Because you didn't do anything to deserve it, so... yeah.
Those are the questions I have for you. Is there anything else you would like to say?
No, not really, no. It's difficult because it feels like I haven't been that affected, truthfully. There's some heartbreaking stories out there, and it's had massive impact on people's lives. But at the same time, when somebody said, would you like to give a statement? I just think, well, we all need to, really, don't we? Because we need to get to the bottom of this, and we need to prevent it happening again. So, that's it, really.
Well, I don't think you can possibly say that it hasn't affected you. It obviously has affected you and Tom. But you've given us a very lively account of living with uncertainty and looking for answers to the questions that you have, because they still, I wouldn't say worry, but concern you.
Yes.
And I'd just like to thank you very much for that. And can I thank you both as well, Tom too, because you've come here today to describe the conditions from which Tom suffers and which you have mothered. And that's not easy. It's very brave, in my view. Thank you.
Thank you.
Well, we'll take a break until 1:30.
And after the break, sir, there will be no live stream for the next witness, but we will have a live stream for the fourth witness of the day.
So if anyone is out there and taking a stream, they might expect that the next witness will be, about an hour and a quarter, we think?
I think so, sir, yes.
About an hour and a quarter. So it may very well be sometime round about 3 o'clock that we will resume streaming.
That's correct.
But for now, I'll see you again at 1:30.